Hey guys! So today, as you can tell from the title, I'm going to do kind of a video on what you can expect when you're having your surgery. No matter what the surgery is, the protocol is the same. Whether it be outpatient, inpatient, or whatever the surgery. I'm going to base it off of all of the surgeries I've had. So to start with, I'm going to go with my most recent because that's one I actually remember. But I'm also going to combine it with the first one I had, the very, very first one, because the pre-op and stuff like that is different than the one I just had. So I had my first surgery in 2012. So that surgery, that one was, the prep was a lot more, how can I say this? It was a lot more straightforward. It was like, you know that medicine you take when you have a colonoscopy or any other surgery, you take that stuff that cleans out everything in you. I took that like right before I went to sleep, the night before, but then, okay, so like 2 days before I could have food, and then the day before surgery I could only have clear liquids, and the day of surgery I couldn't have anything after midnight. So I stayed, because my aunt lives so close to where my surgery was, my mom and I visited her for like a day, and then I mostly stayed in a hotel room the day before because I couldn't eat, and I don't like temptation because I will literally eat everything in sight. So we kind of just, well, I hung out in the hotel room. She went a little bit around where we were. There was a shopping center near us. So the prep is kind of, it's very detail oriented, the first surgery. So then the morning of my surgery, I know we left to go to the hospital at like 5:45, so then my surgery was at like 7:30. So we got to the hospital and there was like no one there because it was super early and the next shift of nurses weren't even there yet. So we got there, and for the hospital I went to Lucile Packard. We had to get a badge and they had to take like a picture so that they know who was in the hospital. So we did that, and then surgery is straight through the door and to the left, and so we went down there, and I went to visit my friend there recently, and I got pretty emotional. Like, I never showed any kind of emotion, but inside I was like breaking. It was so hard to be back in that hospital after all of the surgeries and the complications that I had. So that was so total sidetrack. So we went to Ford Surgery, which is like the part of the hospital, and went through like double doors, and there's like a waiting room, and you talk to like the nurse, then she checks you in. So we did that, and she gave me my hospital band and my allergy band. So this may be different for some people. I did not anticipate this happening. They were like, "We need a pregnancy test," and I'm like my mom couldn't even sign off on it. She's like, "She's not sexually active, like that doesn't make sense." So I couldn't pee. Like, I literally had nothing in me because, like I told you, the prep beforehand is pretty intense, so I had nothing in me at all. So then I was super dehydrated, obviously, and I was still feeling really, really sick. It was horrible. The morning of, I had pain. I could barely stand up because I was so tired and fatigued, and it was really tough on my body. So then that was fun. So then they brought me back, and then they gave me, like, at Packard for pre-op, you have like a glass, sometimes it's just a curtain, but they have like a glass thing, and then there's a sliding door and a curtain that covers the door, which I really like because then it was quiet. They started an IV, but then they had to pull blood for the pregnancy test, and I was super dehydrated, so it hurt. And they rushed the results, of course. Wasn't pregnant. And so then they put me back into surgery. And so what you can expect in the pre-op area is nurses. They will be everywhere. And so you're laying in your bed and they check you in, and like I said, you go into the waiting room and they put the bands on, and you usually wait in the waiting room for a little while. You'll have a nurse call you over, kind of like a secretary nurse almost. Sorry. Kind of like a secretary nurse, and they will ask you all these kind of questions about your medical history. Basically, like, have you done drugs, have you smoked, and they will ask you that question probably 5 times before they take you back, just to kind of clear it all up and make sure that you're healthy enough to do this. And then when you get back there and you're in your bed and you're dressed and everything, you'll have a visit from your anesthesiologist, your surgeon, the nurse that'll be in the OR with you, and then your other nurse, who is the pre-op nurse, will be there with you the whole time, or your mom or your dad, sibling, whatever, they'll be with you. Most of the time they'll let you come back for pre-op. Post-op, you have to be very particular. You have to say, I want them back there right away. Like I've said in other videos, they don't always listen. You have to be very demanding. And don't worry about being nice, because they're going to do whatever they want regardless of if you're nice or not. Don't get me wrong, use manners, like basic manners, please and thank you. But don't be like super rude about it, but it definitely helps if your surgeon likes you, because they're like the head honcho of everything, so they can do everything. So the OR. So once you've had a visit from all of those doctors and those nurses and stuff, they will have 2 people from the OR. Mine were guys. Other times it's been 1 person. It really depends on their protocol. So these 2 guys came and got me, and they just made some, like conversation or whatever, and I actually still remember the conversation. They were like, are you nervous? And I'm like, no. Like, I was so excited, because it was just like, I won't be sick anymore. And so the trip to the OR was actually really short. The recent hospital I went to was actually a little bit longer. You had to go down a floor and then through a hallway and then back in the sterile area, and it was like a lot longer than the one at Packard. So like pre-op is right here, you just turn and you just go down the hallway, it's like right there. So then it was really funny, because they're so used to dealing with like 5-year-olds. They're like, all the machines in here, and then I'd watched a video like the night before and I was like, are not all for me, I know, and I like finished his sentence. I think he was kind of annoyed, but it was funny. So then I went in there on my gurney, and they're not kidding, there are so many machines in there. There's like the respiratory machine, the pole that holds like all the fluids and stuff you're getting during surgery. There's sometimes an X-ray machine in there depending on the surgery they're doing. It's cold. Be prepared. The OR is cold. What else? The OR table itself, you would think would be like hard and uncomfortable. It's really not. They usually have like a pad. It's like a padded bed almost. It's like the gurney, basically. It's the same kind of pad on it. The one at Packard, though, because they're so used to tiny little children, it was like a blow-up thing. Like, it was just like, picture a blow-up mattress, but smaller. It was like this wide and like this thick. It was really nothing, but it was warm, and I was like, oh my gosh, this is warm. So they put your gurney up next to the table, and then you just kind of, if you're conscious, sometimes they'll give you sedation. You can ask for sedation too if you're nervous. Just say, I don't want to be very aware of what's going on, and they can give you something to relax you, sedation or whatever. You need to ask for that a few days beforehand, because sometimes it'll be a prescription like Vicodin. So then they take you in there and they put you next to the gurney, and they'll just transfer you over, and usually with anyone they'll kind of untie the back of your gown so that they can take it off, and then they'll put the little the monitors on you, and before you know it, you'll be out. For the first surgery, I did not get an IV, which is, I forgot to mention that. I said that I got one, I forgot, but I didn't get one, because I knew I was going to be really dehydrated, and I did not want to have an IV when I was awake, because trying to get access into a vein when you're dehydrated is very painful. It can be, unless you have a really good phlebotomist. So then I went out with a mask, so they just put the mask over my my face. It smelled horrible. Horrible. Oh my gosh. Never again. I don't care how painful the IV is, I'm never doing that again. But, if you're scared of IVs, it's not that bad. The taste kind of goes away after a while. When you first breathe it in, it's like more of a really bad smell, and then it just kind of starts to taste really nasty, but then you're out by the time you realize how nasty it tastes. And sometimes you wake up and you can still taste it, but that's kind of rare. So that's basically it. I mean, they put you out, and if you do it with an IV, they have like this really big syringe of just, it looks like milk, honestly, it looks like milk. Sometimes it itches, sometimes it doesn't. When they put it in your IV and it goes through the part that goes into your vein, it'll kind of itch and burn a little bit, but by the time you realize how bad, you're out. So that's what's great about anesthesia, is that by the time you realize how bad it is, you're just gone. And sometimes, I mean, this has happened with me almost every single time, they put me out with the mask, like I said, and then, so I'm laying on the table, and I swear I opened my eyes during surgery. Like, I remember my surgeon standing right over me, and I saw a bunch of nurses and interns, and I'm just like, and then I saw the mask come back over, and I'm just like, I was out. And then when I was laying there for, I think it was like 6 or 8 hours, I swear I heard them talking. Like, any of you have had surgery, you know what I'm talking about. It's like that echoey sound. It's really kind of weird. It's like, when you're, it's also like when you're a patient there and they come in and the doctors are waiting for you to wake up and they're just like hovering over your bed, like, yeah, it's like that. And they're just like, hey, wake up, or whatever, and it's like a really faint echo. It's not creepy, it just kind of sticks with you for a while. And I asked my surgeon, I'm like, did I ever open my eyes? And they were like, no, we were watching the whole time, you never opened your eyes. I was like, are you sure about that? Because I'm pretty sure I did. That's basically it, all you can expect. With my other surgery, the recent one in July, it was, I mean, the prep was not as extensive because I no longer have a colon. I don't have to do the clean out, which is glorious, by the way. Yeah, I think that's basically it. And then I had a question for you guys. I was thinking about starting a beauty channel, just, you know, like makeup or outfits or whatever, but I'm not sure if any of you would like that. I would, of course, do it on a different channel because this is devoted to ostomies and ulcerative colitis and Crohn's and stuff like that. And I also kind of want to start vlogging because I have an old camera that's like really tiny. I just don't really know how I would do it, so let me know if you guys want me to, because I will do it if you want me to. I'm more than happy to. I'll try to figure it out. I might do it. I'm gonna go ziplining soon. I think that'd be really fun. I don't know what the rules are with that, but as a viewer, I think it would be fun to watch. So if you guys want me to do that, I am more than happy to. Just let me know. And I only have a couple more video ideas, so please send me your requests. I would love to get suggestions. That's basically it for this video. I hope you guys enjoyed and took something from it. And if you're nervous about your surgery, feel free to message me or email me. And it goes directly to my phone, so I usually reply pretty quickly. I'm really not as busy as I seem. I like to think I am, though. So if you have any questions, feel free to put them in the comments, and I hope you guys are enjoying this new camera. I am really loving it. Once I figure out how to kind of play with my camera and stuff, I will definitely start to edit more and make it more fun for you guys to watch. I know that just watching me sit here and talk to a camera is kind of not fun. I try to make it as fun as I can. So I hope you enjoyed, and I will see you guys in my next video. Bye!